So, hi everyone. We will be discussing about the anterior triangle in this video, mainly about the carotid triangle. So, we will get firstly the orientation about all the triangles and the muscles. This is sternocleidomastoid. This is clavicle, sternum, and this is mastoid process, and this one is mandible. So, this is sternocleidomastoid. This is hyoid bone, anterior belly of digastric, posterior belly of digastric, and superior belly of omohyoid. The inferior belly of omohyoid is present in posterior triangle. So, and this is anterior median line. Anterior median line, this divides this area into two triangles, that is muscular triangles, these two muscular triangles. The carotid triangle, digastric triangle between the anterior and posterior belly of digastric, and submental triangle between the two anterior bellies of digastric. Now we know the boundaries and orientation. We will proceed to the contents. So the submental triangle, contents of submental triangle, that is 2 to 4 submental lymph nodes are present. A small submental vein which joins to anterior jugular vein, and the contents of the muscular triangle, that are infrahyoid muscles. So there are four infrahyoid muscles, that is sternohyoid, sternothyroid, thyrohyoid, omohyoid. So now the most important star topic, that is the carotid triangle. So we are already seen the boundaries of the carotid triangle, that is sternocleidomastoid, posterior belly of digastric, and superior belly of omohyoid. So now the floor. We know the digastric triangle, this is hyoid bone, this is thyroid cartilage. And from the thyroid cartilage, inferior constrictor originates. And from hyoid, middle constrictor. Between the hyoid and thyroid, there is thyrohyoid muscle. Also from hyoid to tongue, that is hyoglossus muscles. So these four muscles plus hyoid and thyroid cartilage are the floor of the uh, carotid triangle. Now coming to the roof, that is skin, superficial fascia, platysma, cervical branch of the facial nerve. Facial nerve, cervical branch. We know that is there are five branches, terminal branches of the facial nerve. And the last part, that is cervical branch, is present in the roof of the carotid triangle. And anterior cutaneous nerve of neck, that is the branch coming from the posterior triangle and from the nerve point. Now coming to the contents. First we will see the diagram. We will learn from the diagram. So this is the carotid triangle, and this is carotid sheath. Obviously, the name indicates carotid sheath is present in carotid triangle. Now we know the contents of the carotid sheath. Now this carotid sheath is in common carotid artery, divides into external carotid artery and continues as internal carotid artery. And this is internal jugular vein. Internal jugular vein, between these two, this is the vagus nerve. So all these three are the contents of the carotid sheath. Now another nerve, that is spinal accessory nerve, coming from the digastric triangles, enters the carotid sheath and leaves the carotid sheath in the carotid triangle and enters the posterior triangle. We have seen this in the posterior triangle as well. So this is the course of spinal accessory nerve. And another nerve, that is hypoglossal nerve, enters from the digastric triangle, then in carotid triangle, and back to the digastric triangle. These are the three nerves, that is spinal accessory, hypoglossal, and vagus, internal jugular vein, internal carotid artery, common carotid artery, and external carotid artery with its five branches. So what are the five branches of the external carotid artery? That is superior thyroid artery going to the thyroid gland, lingual artery going to the tongue, facial artery going to the face, ascending pharyngeal artery to the pharynx, and occipital artery. So these five branches are also the contents of the internal carotid artery. Sorry, external carotid artery. So thank you.